So last year, we hosted a fundraiser for the National Abortion Federation, which is a fantastic group. And this was in the wake of the overturning of Roe v. Wade. And since then, there has been obviously a lot of news in the abortion arena about the fact that certain states, many states, are now following this fascist playbook to outlaw or restrict abortion to the point that it's not even useful. Women's health care has been absolutely curtailed in the United States. And we are once again going to host another fundraiser because of the interaction you had with that, and we really appreciate it. Today, we're joined by Melissa Fowler, who's the Chief Program Officer of the National Abortion Federation, and Ellen, who is a counselor at an abortion clinic in Florida. Thank you guys for joining us so much.
Thank you so much.
Thanks for having me back. It's great to be here.
Yeah, Melissa, just as a refresher for everybody, it's been over a year now. Can you tell us a little bit about what exactly National Abortion Federation does?
Sure. So we're a professional association that supports all different types of abortion providers. So our members include independent clinics, Planned Parenthood clinics, hospitals, virtual and telehealth providers, all across the U.S., Canada, Mexico City, and even in Colombia. And we provide all different types of support services to those providers. So everything from 24/7 security, quality assurance, training on medical things, continuing medical education, and a really important community for providers. And Ellen can speak to that as being someone who's been part of that community for decades. And just the kind of support that it provides to people who are on the front lines. And then in addition to those provider services, we run the largest national abortion hotline in the country and the largest patient assistance fund, where we're able to help more than 100,000 people a year actually pay for their abortions and pay for the travel costs, which have just skyrocketed, as you can imagine, in the last 2 years since the Dobbs decision and since so many states have banned abortion.
Well, and the Dobbs decision, which overturned Roe v. Wade, it came down on June 24th, 2022. So we're, around that 2-year mark. And these abortion restrictions that states are putting into place are continuing, like in Florida, where they just recently put into place that 6-week abortion ban, making the work that the National Abortion Federation does more important than ever. And, Ellen, since you are a counselor at a clinic in Florida, can you talk a little bit about the work that you do at the clinic in Florida and what the post-Dobbs landscape looks like in that state, especially with this 6-week ban that recently went into effect?
Of course. And thank you for this opportunity to have this conversation. What happens inside of our center, a lot of people don't understand that every time a restriction happens or changes, we really do have to adjust our whole care delivery model. And so May 1st, we went from a 24-hour waiting period where patients have to come in, do ultrasound lab, meet with a physician, and then they can't have their abortion for any sooner than 24 hours, to a 6-week ban and a 24-hour waiting period. So where patients are struggling with now having to get time off very quickly, because as you can imagine, patients have to come in at 5 weeks and be seen within a few days in order to have their abortion. So that's a financial struggle for them, getting time off from work 2 days in 1 week. That can put your job in jeopardy. And unfortunately, the people who are impacted the most, as always, are those who are, marginally housed, or those who have a language barrier, those who are low income. These patients don't have the resources to be able to make this move that quickly. So we are reaching out to the National Abortion Federation very frequently, as well as our local funders here in Florida who have just been amazing and stepped up and done their own fundraisers so we can help patients navigate this, being able to see patients here in Florida and then send patients who are over 6 weeks outside of the state of Florida so they can still access services.
Let me ask you this, Melissa. It seems kind of the natural ebb and flow of people's interest or engagement in politics and the news that when Roe fell, when the Alito decision was leaked and then subsequently made official, there was a lot of outrage and there was a lot of passion and people donated a lot of money. How has your intake of donations been impacted by this 2 years of drips and drabs of headlines and people's maybe diminished engagement on the issue?
We definitely saw that outpouring of what we call rage giving, and people who were really paying attention. People were contacting clinics every day, wanting to volunteer, wanting to help. And rightfully so, they were outraged. It's an outrageous decision. And we knew it would be really devastating for years to come. And we're living that reality. But it's not top of mind for folks, even when it is in the news. We know the news is very confusing. We hear from patients every day. They don't know if abortion's still legal. They don't know what it means. They don't know where they can get care. So there's a lot of confusion out there. And while we did try and make the case at the time that we need long-term support, unfortunately, a lot of the gifts that we got were one-time gifts, which were great. And we've used them to help people access care. But in 2023, our donations to the hotline decreased by 40%. At a time when more states were actually putting those bans into place and we were getting more requests for assistance, and patients calling us after DOBS they need a lot more help. They're going to have to travel a lot further. They don't know what's out there. The calls take longer. They're starting with less and less money. And now on top of the procedure, which they've got to come up with quickly, they've got to come up with all of these travel expenses. And I mean, we're spending about $1,000 per patient just on travel to help people access care. And so we definitely have seen that decline in donations, which unfortunately correlates with the patient need really skyrocketing. In the first quarter of 2024, we've actually funded 14% more patients and spent 20% more money than we spent in 2023. And that was before the Florida ban went into place. And just so you understand, I mean, Florida was such a critical access hub for us. If you look at a map of the US, it's surrounded by states that have banned abortion, and it's surrounded by people who have no other option but to get in their car and drive straight to Florida. And we really saw that happen. In 2023, we funded the most procedures in Florida, more than any other state. And it was about 16% of all of the funding that we provided. And that included people in Florida, because there are a lot of clinics in Florida and a lot of people that live in Florida, and people from all over the Southeast who were traveling there. And so even though the 6-week ban is in effect just in Florida right now, the ripple effect of that is actually going to affect patients throughout the entire region. It's going to push people further, where now they can't just go to North Carolina. They're going to have to go to Virginia or DC. And that just adds time and cost when they don't have those things.
I imagine there's also an added difficulty, like you said, about people just not knowing what the actual laws are and what the restrictions are for their various states, especially with the headlines coming out about the different Supreme Court cases and whether it's involving the abortion pill or EMTALA, the case that's getting ready to come down. I mean, how are you guys feeling about these Supreme Court cases and the pending decision on EMTALA?
So we were relieved with the medication abortion decision, but really it's a technicality. They didn't have standing. We knew that. It's a bogus case. It's still really frustrating that it got that far at all. And we're totally prepared for them to bring it in another way and to keep trying. We know they're not going to give up on that. It's just outrageous that we are considering these things and that we would be considering whether, hospitals have to provide emergency life-saving care to people. It's so heartbreaking to see abortion singled out in that way. And we talk to patients, and we know patients who have had to access care in those situations, who have faced really terrible complications, and they need emergency abortion care. We know abortion saves people's lives. And we know it helps them have better health outcomes and better economic outcomes. And, we're bracing for more restrictions and more things to happen and really trying to just shore up access where we can.
And Ellen, being on the ground, what is it like for you in terms of increased harassment or some of the anti-abortion activists feeling emboldened by the progress that anti-abortion activists have made, even as abortion rights are increasingly popular and there are losses at the ballot boxes? What is it like for you on the ground with that harassment, with those threats?
It's very scary to be a provider anywhere, but Florida is particularly hostile. Recently, when the 6-week ban went into place, we always know that people call and they're acting like they're patients to get information. But they went so far as to record me trying, obviously, to get me to say something that we don't do, and posted it to YouTube. And there's an article online. So, we're very vulnerable here. We're an island in the middle of this ocean of hostility, and we have protesters outside every week. We have one gentleman who has made his mission to target us specifically, and has made bogus complaints to the state, and the state, has to honor that and comes in and inspects us. And, naturally, we cross all of our T's and dot all of our I's because we're excellent healthcare providers, and that's what we do. But, if someone complains to the state, whether it's a legitimate complaint or it's just harassment, they have to take it seriously. And that's, wasted money for the state, and just puts us in it's a very defensive position to be in.
Let me ask you this, Ellen, kind of adjacent to that, with the intimidation tactics that are being used by the right. Can you tell us a little bit about some, generally some patient experiences and what it's like dealing with these people who are seeking healthcare and having roadblocks thrown up in the way of intimidation and misinformation and disinformation? How's that been on the ground working with patients?
So one of our biggest challenges here are what is called crisis pregnancy centers. Yeah. And these centers are not licensed by any medical board or any medical institution. And their marketing and their advertising is abortion options. We can help you. They use all the good words. And when the patients get in there, it's faith-based, and they do try to manipulate patients. Their ultrasound findings aren't necessarily accurate because there's no one who is checking their ultrasound machine. There's no one who is training them. There's nothing to say that the information that they give has to be aligned with the real medical evidence. And I took a call from a young girl today who was just hysterical. She could not understand how they could be so manipulative and get her in there and then just completely not give her the services and care that she needed, and just had her so confused, and she left there shaking. And fortunately, I was able to spend some time with her on the phone and give her the reassurance that she needs, that there is legitimate care. We are absolutely one of those places, and was able to give her the help that she needs. But the crisis pregnancy centers are all over the state of Florida, and they are just so manipulative, and patients get just very bad information there.
Seems to me evident that that's by design, that they are going to muddy the waters.
We have one right across the street from our office.
And they're just confusing on purpose in order to
right, because if they tell a patient that they're 4 weeks today, the patient might not be 4 weeks today. So if the patient's like, oh, I can go next week for my consultation for my 24-hour, and she gets here and she's already 6 weeks, then they've just manipulated that patient out of services here in the state of Florida.
Yeah. It's sinister and disgusting, and they're putting real lives in danger. Absolutely. And taking away people's autonomy and agency to make choices that are going to be best for them in their lives. It's unconscionable.
Without question.
We're all on the same page about that.
Yeah. Yeah. Well, and let's say someone's watching this and they're on the fence. They want to get involved. They want to support. Maybe they're thinking about making a recurring donation, making a donation to the fundraiser that's on this video. What could you both say to them in terms of what it is that is so important about the work that the National Abortion Federation does? Not just the National Abortion Hotline where someone can call and get assistance, get actual factual information, not a crisis pregnancy center situation, but factual information. They can get resources to fund travel assistance, all those important things. I mean, what would you say is so important about the need that you have right now?
I think one of the things, and we talked about this last time I was with you and you talk about it on your show, I think that the important thing is to recognize that this is part of a coordinated attack on our democracy. Like, even if you don't think you're ever going to need abortion care, or anyone you know or in your family will need it, which they will, and you know someone who's had an abortion, these attacks are being led by the same people that are attacking many other rights and freedoms that we enjoy. And we need to stand up for all of them. There is clear data that when people have the ability to make these choices and to access the healthcare that's right for them, if that includes an abortion, it benefits their lives in a positive way. And when they're denied that care, they have poor outcomes moving forward. They're economically challenged. They are tied to abusive partners. Their children suffer and have health issues. And so we need to be working globally to help people have that autonomy and to have the ability and the freedom to make the choices that are right for them. You know, it's abortion now, but they're already talking about contraception. They're already talking about other things. And so this is the time to get in the fight. Even if you think this isn't for me, they are coming for you or for some right that matters to you and your family. And it's really important, not just when abortion's in the news or there's a terrible ban, to be thinking about it and fighting for that right and supporting the providers in your area. Because no matter what happens with abortion bans or pills in the mail or other things, we need brick and mortar clinics like Ellen's. We need those centers because there are always going to be people that need care or that want that type of care in clinic. And we need to sustain those centers. And so if you're lucky enough to live in a place where there are still clinics, we need to be supporting those clinics and making sure that they're sustainable and that they feel supported and that they know that the harassment and things that they experience are not okay, and that those communities don't support that and don't want to sit by and let those healthcare providers be targeted. Because it's not just about today and this next election and this next round of bans. It's really about preserving our freedom and autonomy for the future.
Mm-hmm.
Yeah, I mean, you very, very clearly said, very true. We talk a lot. I talk a lot about on my YouTube channel about the threats to democracy and some of the other measures and initiatives that are being taken by certain groups out there that are conservative leaning to stifle not just reproductive care, but like you said, contraception, the rights of the LGBTQ. We're starting to witness a full-blown fascist moment in America. And this is why I advocate for donating to fundraisers like this, to fund organizations like yours and the work of Ellen. Because, look, you might not think that your piddly amount of $2 or $5 or whatever is important. But if we're able to marshal the size of our audience and others out there to all give $2 or $5, we could make a very real difference in very real lives all across the country of people who are finding themselves in situations that they need help in, that will inextricably alter the course of their lives and not for the positive. So I would encourage everybody to give to this fundraiser and support a noble cause like this. Less important is thank you for being here, but more important, thank you for the work you guys do. It can't be overstated how important it is.
Absolutely.
Thank you for giving us this platform, because it's important for people to really hear what's going on, because abortion care it affects everyone, every class, every race, financial, income, no matter who you are and where you are. Unexpected pregnancy happens, and it shouldn't mean forced pregnancy.
Yeah.
That's great. Thank you so much for being here. We appreciate you both, Melissa and Ellen. Thank you so much.
Thank you.
Thank you.